Welcome back to our channel. Today we're diving into a USMLE Step 1 question focused on applying foundational science concepts related to the female reproductive system. Let's get right into the question. Here's the question. A 42-year-old nulligravid woman comes to the office because of a 1-year history of increasingly irregular vaginal bleeding and menstrual cramps. Previously, menses occurred at regular 28-day intervals and lasted 3 days with minimal cramping. During the past year, menstrual periods have occurred at 21 to 28-day intervals and lasted 10 to 12 days with increasingly severe pain. Use of acetaminophen and ibuprofen has provided minimal relief. She used an oral contraceptive from the age of 17 years to 40 years, but she discontinued use after she was diagnosed with deep venous thrombosis of the right lower extremity. She has no other history of serious illness and takes no medications. Her mother and sister underwent hysterectomy at the ages of 39 and 43 years respectively because of abnormal uterine bleeding. The patient is 163 centimeters or 5 feet 4 inches tall and weighs 75 kilograms or 165 pounds. BMI is 28 kilograms per square meter. Vital signs are within normal limits. Physical examination discloses an enlarged, irregularly shaped uterus with nodularity. Which of the following is the most likely cause of the patient's symptoms? Let's break down the scenario. This 42-year-old woman is experiencing increasingly irregular and prolonged menstrual bleeding with severe cramps. Her history and physical exam reveal an enlarged, irregularly shaped uterus with nodularity, which is a significant clue. The patient's use of oral contraceptives until the age of 40 and her family history of hysterectomy due to abnormal uterine bleeding are also important factors to consider. The physical examination findings of an enlarged, irregularly shaped uterus with nodularity strongly suggest a specific diagnosis. Let's evaluate the options. Asterisk option A. Benign monoclonal tumors arising from smooth muscle cells. This describes uterine fibroids or leiomyomas, which are common and match the patient's symptoms and physical exam findings. Asterisk option B. Endometrium growing into the myometrium. This describes adenomyosis, which can cause heavy, painful periods, but the physical exam findings are more indicative of fibroids. Asterisk option C. Endometrium growing outside the uterus. This describes endometriosis, which usually presents with pelvic pain and infertility, but not with an enlarged nodular uterus. Asterisk option D. Failure of functional ovarian cysts to regress after the release of an ovum. This describes persistent ovarian cysts, which wouldn't typically cause an enlarged, irregular uterus. Asterisk option E. Ovarian stromal cells dividing and multiplying rapidly. This describes ovarian tumors, which are not typically associated with the described uterine findings. The correct answer is A. Benign monoclonal tumors arising from smooth muscle cells. Uterine fibroids or leiomyomas are the most likely cause of her symptoms given the enlarged, irregularly shaped uterus with nodularity. To recap, when approaching questions on the female reproductive system, pay close attention to the clinical history and physical exam findings. Look for patterns that match common conditions. Understanding the typical presentations of different gynecologic disorders is key. For more study tips and practice questions, be sure to subscribe to our channel and hit the notification bell. Thanks for watching. If you found this video helpful, give it a thumbs up and leave a comment with any questions you have. Good luck with your studies and see you next time.